Can I use medication to jumpstart my weight loss? That is what we're talking about today. Hi, and welcome to my channel. I'm Dr. Megan. I'm a doctor, I'm a life coach, and I help people with their weight. I'm board certified in internal medicine, lifestyle medicine, and obesity medicine. And I also help people around the world with the non-medical aspects of their weight loss. So if you are on a GLP-1 and you've reached a plateau and you're like, now what do I do? Or if you're someone who never wants to start on GLP-1 and you just want to do things via lifestyle, I can help you with that. So I will leave that info down below. But today we are talking about this question of, can I jumpstart my weight loss with medication? This is probably one of the top 3 questions I get asked in clinic. And I think I've touched upon this in a variety of ways in different videos, but I just wanted to address this one question more specifically on its own because it does seem to be very prevalent. And so I think what people are talking about is they've kind of reached this place where they know they need help. They're not sure what to do. They think the medications could be helpful, but they just want to try it for a little bit, get things going, and then go off of it. And as I think many of us know by now, that these medications are really, we should be thinking about them as forever medications. At least at the time of this filming, we do not have a protocol yet in place that really gives us good evidence in terms of a different type of maintenance other than staying on the highest dose that we can tolerate that's giving us the effects that we want. So that might be 15 milligrams of Zepbound for somebody. It might be 2.4 milligrams of Wegovy for somebody. It might be 5 milligrams of Zepbound for somebody. It's going to be different for everybody, but right now we really should be operating on the expectation that this is a lifelong medication. But I know it can be really tempting for people because they feel like I just need this one little boost and then I'll be able to take care of the rest, or I just need something to kind of get things moving. But that's not really, I think, the most effective way to think about weight loss in general, because what we really find is, whether it's lifestyle, whether it's medications, you want to be making changes for the long haul. We don't want to be doing things short term, and that's kind of how we get into how people get into these problems, this kind of cycle of off and on and off and on and trying these different things, so we don't commit to things for the lifelong, so we can really stick with the changes that are happening. So I do want to also touch on some really helpful studies. If you want to do a deeper dive into it, it can be very helpful. So I'm not going to go into the, minute details of these, but I will leave the references down below. But these are 3 very helpful studies if you still think that you want to jumpstart your weight loss and then maybe go off the medication in the future. Like I said, 5 years from now, we might have a protocol that's very different than what we have now, and that would be wonderful. I would love it if there was some sort of lower dose, more spaced out maintenance type of protocol. People, might be doing that right now on their own. We just don't have the data, and it's not something that I'm going to be recommending to my patients right now. But let me give you these 3 studies right now if you want to take a look and see what the literature shows. Study number 1 is the SURMOUNT trial, which was Tirzepatide after they put people who did not have diabetes but did have overweight or obesity on Tirzepatide, kept them on an escalating dose, and then at the middle point, they swapped them. They did a double-blind, it was randomized and blinded swaps. So some people stayed on Tirzepatide and some patients got placebo. And what they found was the vast majority of the people who got the placebo, as they followed them for another, I think the study went from, this period went from 36 to 88 weeks, they regained significantly more of their weight back. So when people who are, people who went from week 0 to week 88 On tirzepatide, they lost about 25% of their total body weight. So at the lead-in period, the average weight loss was about 20%. And then the people who got switched to placebo, by the time the study wrapped up at 88 weeks, they had actually ended up only losing about 9 to 10% of their body weight. So they had gained back quite a bit. And who knows, what would have happened if they extended the study out another year. But we can expect that probably people would continue to gain the weight back. Most people, not everybody, but most people. There's also the Step 1 extension trial that looked at subjects who were on semaglutide, 2.4 milligrams, and then they had gone off of that medication and they regained about 2/3 of their prior weight loss. So again, a pretty significant amount of weight regain. And then the Step 4 trial was with semaglutide, but it was a similar kind of setup as the SURMOUNT 4 trial, in which subjects started out on semaglutide. Some subjects were then randomized after a certain point to receive placebo. And again, the people on placebo did regain a significant amount of their weight. So I will leave all those references down below. But again, the question of can I jumpstart my weight loss with a weight medication? Not advisable at this point. Really think about whatever change you're making as something you are making to be so you're in it for the long haul. That's going to do it for today. Thank you so much for watching. The references will be listed down below. If you have questions about any of this, please let me know. I always love answering your questions. Thank you so much for watching, and please be well.